I'm Fiona Lenevue. I'm the manager of the Brimbank Melton Children's Health and Wellbeing Local, which is otherwise known as the Children's Local. One of the great advantages of the Children's Local is that we provide a multi-disciplinary service all under one roof. The Children's Local is a consortium of a tri-partnership where IPC Health is the lead provider, and we are supported by mental health staff from the Royal Children's Hospital and paediatric and allied health staff from Western Health.
Multiple services under one roof is so crucial for a lot of our families who have difficulty accessing services due to a whole variety of challenges. Being able to come in and see a few people, or even just to see people who can talk to each other and have a conversation so that you're not having to retell your story, is so important for that coordinated and collaborative care.
We have Tanika, she's our eldest child. Tyrese, he's our only son. He is autistic but high functioning. We have Trinity, she's recently been diagnosed with autism as well. And we have Tamaya, who's our youngest, who is ADHD, but she's very, very bubbly.
I guess most of the challenges that they have are outside the house. People come into the house, I'll talk to them, but once we leave the house, the three younger ones in particular, they clam up and mostly become antisocial. With our son, there was a lot of hopping around to different places and seeing different people, to get that diagnosis.
So lots of paediatricians, lots of psychiatrists, a lot of time off school as well. But I think a lot of the exhaustion came down to mental exhaustion as well, because it was a lot of information. Sometimes we would worry about, did we leave something out with this person, and didn't we give enough information to that person? It took a lot of time away from Trinity, our third child. It took a lot of time away from them when they needed us most.
The Huntlys aren't an isolated example. Most of the families, when we're talking about child development, we're generally talking about concerns in more than one area of development.
The Well for Life strategy is really focused on holistic health, so looking at the mental, physical and social needs of individuals. So how we partner together and collaborate with multiple services to support a family or a child where they're at, and having them be well for life, whatever that might mean to them.
And that Well for Life strategy is looking at prevention, intervention, education to empower our clients to become more in control of their healthcare, so it's not escalating to a point where they need to go to hospital.
We can provide those better outcomes by understanding the family from a holistic perspective. We don't necessarily have to see families at a centre. So families don't always have to come to us. We can go to families. We are flexible and able to meet the families where they need to be.
With IPC Health, when they initiated with us to have a home appointment, it was to meet Trinity in her own environment, which made her feel more comfortable as well.
It was really good to see her just open up to a stranger the way she did. It's not just about the kids, it's about the family as well. So it's been a much better experience going to IPC Health than travelling to 20 different doctors. It's life-changing for us as a family.
For us as a family, there's been a lot of change, but that change has actually really helped us to the point where, we're getting, closer to each other, being a little bit more happy, instead of being very grumpy at home, it's a much better.
So the difference with IPC Health compared to other community health organisations is that we are prepared to challenge the status quo, working outside of the usual frameworks so that we can get the best client outcomes. We're doing what we can see internationally is best practice in health and social care industries as well. Working collaboratively and with multidisciplinary teams, we do see far greater outcomes for clients, and there's international research that supports this as well. And it really is just piecing together the puzzle for a particular family. When you've got collective heads, discussions around the table, you can start to figure out what's happening and work with that person about what's most important for them and how they want to see their lives change. And so it is a life-changing experience for a lot of people.
We have fabulous staff who are really committed to that, who are really committed to supporting families to be the best they can be and reduce the barriers that they are facing in accessing timely supports for themselves and for their children.